you can compound, pretend, like glycine, taurine, put some blueberry in there for antioxidant capacity. Like there's a lot of things that you can look at, and, you don't have to start off with a lot.
No.
That's the exciting thing. Maybe start off with the good old vitamin C, blueberry, as I said, some amino acids and basic things. And compounding doesn't have to be extreme compounding. It could be just 2, maybe 3 ingredients, because you're focusing like the sniper effect rather than a shotgun effect of doing 100 things. You're focusing it right down. And that's where, as a nutritionist, not just a nutritionist, you can actually make a very big impact on someone's life.
Hello and welcome. Mentoring with Geraldine is a bite-sized practitioner podcast for naturopaths, nutritionists, herbalists, and practitioners. This podcast responds directly to your needs, the needs of the practicing natural therapist. With interviews, herbal discussions, something business and something clinical each week, you'll get the variety you need and enjoy to stay motivated in practice. Hello, everyone, and welcome to Mentoring with Geraldine and that bite-sized podcast. And I am super excited to have Dr. Brad McEwen with us today. Now, I've met Brad at numerous functions and all over Australia where he's been delivering a lecture, or I've been delivering a lecture. We've met at association seminars, and he is an absolute wealth of knowledge. He has got more qualifications than really anybody needs. Let's be honest. You look down his website and it's just littered with qualifications. So I'm not going to go into all of them. Needless to say, it starts out, obviously, there's a certificate for it at the bottom and it goes all the way up to a PhD. So there's going to be information about him in my show notes if you don't already know him. And if you don't know him, the link to his website is in the show notes as well. Now, Brad has been lecturing and teaching. You were at Endeavour, you've taught at Southern schools, you have your own mentoring program as well. And one of the things that we just touched on when we were chatting before was nutritionists. Now, nutritionists say, I'm just a nutritionist. We both see this in the Facebook groups and it drives us nuts. And so this is today's podcast, because you're not just a nutritionist. And Brad, how do you feel when you come across that little notice?
It's something that, how do I say it, it's a phrase that it's really gets you. It's sort of like, you are not just anything. Let's just break it down. You're not just anything like that. So get rid of the word just. If anything, you should say, I am a nutritionist, or I am a naturopath, or I am like, if you really want to go to the point. So it's sort of, it irks me to a point where it's coming from like a self-confidence. It's coming from probably not even from them. Yeah. It may be something that's been put onto them from other people in their life over the years.
Totally.
Imposter syndrome that we do talk about every now and then. That's something that's quite common in our profession is, should I be doing this? Should I be here? And it's something that, I really want to stamp out if I could. Is that phrasing or that phraseology of it is, I'm just a such and such. And like nutrition for me is the foundation of everything we do.
Totally.
I could say it's the be all and end all, but that's a little bit extreme, but it is the foundation of what we do as health professionals. And in the end, that's what we are. So a nutritionist, a naturopath, a herbalist, etc. We're all health professionals. And it's part of what we do with, when a patient comes to see us, or when we're giving a talk or a seminar or a conference. It's something that gets us excited. It's in our heart. And that's the way we should sort of get out there and say it. I am me, I am this, and get out there and, really get excited about it. And that's where, the confidence will build up, because people will look at you and go, yes, you are.
Yeah. Exactly. I mean, there's the confidence of saying who you are and what you do, why you're there. Your big why is really, really important, because that shows your passion. And there's other things. That's the other thing we always see in the groups as well that we were talking about, is we go into a group and they say, I'm just a nutritionist and I can't give out, herbs, or I can't give out. And there are so many other things. They've got a massive, massive amount of things. And we were chatting earlier about compounding and how amazing that is in practice. Fine, you have to have people coming through your practice to to have enough stock, to be rotating your stock.
That's right.
But there are so many choices out there that don't contain herbs, that don't contain other things that are amazing.
That's
in
right.
all the forms.
And as long as you stay within scope of practice and not go, over the top, like we could literally talk about 100 to 150 different ingredients right now. We could formulate between the two of us for a pretend patient, like Billy Bob, as some of my students would laugh because they'd be waiting for Billy Bob to come in. It's like, no, he's a character of a patient of mine coming into the room, not physically. And it's like, how can, this person presents in a certain way, and you can compound, pretend, like glycine, taurine, put some blueberry in there for antioxidant capacity. Like there's a lot of things that you can look at, and you don't have to start off with a lot.
No.
That's the exciting thing. Maybe start off with the good old vitamin C, blueberry, as I said, some amino acids and basic things. And compounding doesn't have to be extreme compounding. It could be just 2, maybe 3 ingredients, because you're focusing like the sniper effect rather than a shotgun effect of doing 100 things. You're focusing it right down. And that's where, as a nutritionist, not just a nutritionist, you can actually make a very big impact on someone's life.
Totally.
Even just talking with the person comes in to see you and they say, I feel such and such, I'm suffering from such and such, all those things that, people offload to us. And you can say, I hear you. Let's focus on this and let's work with that. And as part of that process, you're taking mental notes down. And then along the way, you're thinking, that's vitamin C. It's connective tissue, antioxidant, anti-inflammatory requirements or something. And then they say something else and it's glycine, because again, connective tissue. So just reminded me of a case that I had years ago, if I can talk about it.
Yeah, totally.
The person wanted to see a nutritionist, and I said, I'm a nutritionist. So they had an injury to their hand where the ligaments were severed.
Right.
And they were seeing a specialized hand surgeon who was like one of the top hand surgeons in Australia. And they said, the hand surgeon's given me 4 weeks to fix my hand, or we're going to have surgery.
Right.
And I've gone, cool. What did they suggest? And they said a splint. And I went, okay, well, a splint's going to sort of mobilize it, but it's not going to do anything cool. So I said, okay, well, let's take the case and do the whole proper thing of, how did it happen? It was a work-related injury and everything else like that. And I want you to imagine that it was such a extensive tension injury. So it wasn't like a knife cut or anything, that kind of thing, but the ligaments were pretty much, shredded. And because of the force of the trauma. So I started taking the case and they said, oh, but I want you to remember. And I went, okay. They said, I'm very sensitive to high doses of things, and I have a very sensitive gut. And I'm like, that's good to know, because that was later on in my questions. So taking the whole case, I went, I'm going to formulate something cool. And that's where the compounding came in for this one.
Yeah.
And I was thinking, what can I do? And I ended up doing glutamine, of course.
Yep.
Glycine and lysine to start with, just the 3 amino acids with some vitamin C. And I gave them some zinc from a company. We won't mention companies, but it was a zinc tablet. So I thought that would be easier on the person at the time, because their digestive issues, giving a zinc powder may have stirred up the gut into working better. And then they'd stop taking it, because that's what happens. So we did that, and they said, oh, what do we do? And I said, well, the dosage I've decided is going to be 5 grams twice a day to start with. But then I remembered this person's sensitive. So let's start with 1 gram. So it's really low dose for amino acid combo. I said, let's do that once a day for a few days. Give me a call. We'll have a review. Calls me up a couple of days. No negatives, no issues, nothing changed. And I went, cool, because that's good. And then I said, let's go to 2 grams for a few days. And then like this process happened for 2 weeks, because remember I had 4. 4 weeks to repair this hand. So we start working on it. And then, after the 2 weeks, we're actually up to 5 grams twice a day, which I'm thinking, this is exciting, because we've progressed pretty quickly for someone so sensitive, because it was actually starting to do its job in the body. And her hand felt weird. And I went, that's good. Describe weird. And she said, I don't know. It's just weird. It's got some kind of tingle or something in it. And I said, that's good. I said,
That's
it's like the
exciting.
nerves.
Yeah.
It's exciting. There's circulation. There's something going on.
Yep.
I said, we'll keep going. So the appointment comes, she goes in and the doctor does, the good old scans and everything else like that, the specialist, I should say. And they've turned around and said, I don't know what you're doing, but keep doing it. We're going to change the appointment date. I'm going to give you another 4 weeks. Because she was actually going in like a couple of days later. That was the plan. So they changed it. And I said, well, what happened? She said, well, the specialist showed scans that it looked like it was starting to repair itself. And I'm like, 4 weeks, starting off low dose of a nutritional, I'm only a nutritionist compound. And it's like, okay, let's keep this going, but let's start investigating further. Like, what else can we start adding into this? So that's when I started adding in some blueberry, increase the dosage, thought about adding in some taurine for the nervous system. So I started sort of playing around with the formula, also noting that taurine is a sulfur-containing amino acid, which might stir up a gut. So I used a lower dose. So I had to not start off again, but sort of implement it as a separate bottle. And then I got her to put in tip a teaspoon into the dose and then increase it that way. So it was compounding with extra compounding. And she loved it because she said she felt like she didn't say witch because she didn't want to sound like that, but it's like she said she had a magical cauldron that she was mixing these powders into. And she was quite excited about it. And I said, all right, we'll keep going. And she was giving me weekly updates. And then I had a couple other patients turn up from her recommendation with other things, which is the way how our business works a lot of the time. And it was exciting to see. And then she came in, at the next 4 weeks. She was about to have a next appointment, a bit nervous what to do. And I said, can you just show me? And, she sort of flexed her hand backwards and forwards, side to side. And during the appointment, I forgot to say this earlier, she had to wear a brace like 23 hours a day. She came in, when she sat down, we started talking, she took the brace off as we were talking. And I went, how often do you do that? Because, you haven't done that before. She said, the last week I started feeling uncomfortable in it. And I've been just resting my hand on my lap and it feels good. And I went, as long as you don't forget and then go out and lift, something heavy or do anything like that. And she was really excited. And then she went and had the appointment. And the news was, keep doing what you're doing. You don't need surgery.
There you go.
We'll keep an eye on it because it was such a traumatic injury. It's not fully repaired, but we'll keep an eye on it because that's, And she was a very good specialist, like very open to things. And then she said, I'm going to see, Brad, he's a naturopathic nutritionist and blah, blah, blah. And she was happy to know that because she was seeing the results. And that's just a simple, quick patient story, of how such a simple thing. There was no herbs. It was just fruit, vegetables, and general good diet and lifestyle and everything else, and adding in the compounding of some nutritionals. And then over time, of course, you take that away. Because in the end, nuts and seeds, like all the good quality foods, unless there's allergies, of course, I'll mention for the podcast. Within reason, all the good quality foods, and that then gives you those foundations. It gives you the architecture for healing injuries like that. And I'm not going to say it's going to do it every time because everyone's different. But if you keep that in mind, I originally gave something so simple at a low dose that really shouldn't have done much for that type of injury. And that's the power of nutrition. And that was my goal because remember, she said she's sensitive to most things. So if I gave her some, herbal liquids, which I could have made up, she may not have been able to have them. And then she may have been, her compliance would have dropped because he's not listening to me. And you know what I mean? Like that whole kind of faith in your health professional is dropped. So,
and I think, glycine tastes nice. So there you are, you're giving her something, then you're putting, what was that, the berry in there.
So the blueberry being antioxidant, anti-inflammatory on its own. So it's such a simple formula. And that's what we forget sometimes. You don't have to go in there all gung-ho. Something simple. And as I said, I then added in a zinc supplement to sort of get the heal and seal kind of effect going on the tissue. And then, as the appointment goes, to sort of finish off this part, put on like a B complex,
Mm.
multivitamin mineral, like a good quality one I use, just to sort of help with that nutritional supply. And the one I chose had a high level of vitamin B3 in it.
Yeah.
And the reason being it's got that, that vasodilatory effect.
Yeah.
Gets the circulation running. But if you remember back to your biochemistry, B3 in combination with B2 works on your Krebs cycle. I don't know how much everyone loves that kind of stuff. And it gets like your energetics working, cellular energetics. So it gave an extra kick to the healing process.
Perfect. Yes, I lectured in nutritional biochemistry. I still have PTSD from that.
I love nutritional biochemistry.
No, that lecture, don't you remember that course? It was hideous. 100 slides every lecture.
Oh, yes. I had to fill in a couple of times when there was no one to do it. And I'm like, we're on slide 2.
Yeah.
So,
every student has PTSD. Let's not talk about it. Let's try and soothe the listeners. It's okay, guys. Have a bit of glycine, a bit of L-theanine when you get in after hearing the words nutritional biochemistry.
Nice.
But isn't it amazing what we can do with our clients? Changing the diet, absolutely essential. That's the base thing that we all do. And then adding these nutritionals in. And yeah, like you said, you've worked with her. She said, I'm sensitive to everything. And when you get these, I'm sensitive to everything, it can be really hard to know where to start because it discounts a lot of your products. And if you are going to do herbs for, a naturopath or a herbalist, you've got to start, one drop at a time to build up their tolerance. And it takes ages to build them up, to take them. And I had a client who came to me and she wanted herbs, but I had to know that she was really sensitive to everything. And so it'd be a really slow process and she'd only take one drop at a time and do it. So she'd already decided. I was like, okay,
excellent.
Could do something else, but all right, let's start with that. And I sent her away with, I think 2 simples to start the process. And then she came back to see me and she said, I went to see a Chinese herbalist and he didn't speak any English and he's given me all these things and I have to take them this really high. She was taking huge doses of a couple of the herbs that I'd given her as a simple. I said, you know what, we're going to stop everything that I've given you. We're not going to do anything. And you're just going to see the Chinese herbalist from now on. And I thought to myself, someone who doesn't speak English for you is perfect because you can't be sitting there. Because she decided, I was very early on in my training, on my in my business. And so someone, when they'd come in and they'd made their decisions already, you're already stumped.
And it's very difficult to work with sometimes.
Yeah, very difficult. And if I'd had, 15 years ago, if there'd been all this opportunity around, compounding and everything, perhaps I would have compounded for her. Because then I could have totally gone away from what she'd said and the options she'd given me. But because she'd come in, this is what I need to do and this is what you're going to do for me. And I was the new practitioner going, okay, all right.
That's it. And that's one of the consequences of being a young or a new practitioner is exactly what you're saying, and in the end, we're very holistic and we work well, one with ourselves, but also with other health professionals and work well with our patients. And sometimes a patient comes in knowing exactly what they want because they read it somewhere or something else like that. And I had a patient come to see me as a nutritionist and she said, do you want me to bring anything in with me? I said, bring everything you got. Yeah. So she came in with a whole briefcase and her
shopping
GP.
The shopping bags of stuff. Yeah. Oh, my Lord. Yeah.
And she brought her GP. She brought her doctor into the consultation. So as part of that process, the person came in and pretty much brought in their whole bag of different things, as well as actually bringing in their GP to work with the process. So it was quite exciting because the GP didn't believe in nutritionists or naturopaths or anything else like that. And going from there was like a very tricky situation.
Yeah.
But halfway through, he was starting to change because I was doing my normal self. Yeah. I was consulting, asking all the questions, and you can see his eyes thinking, why is he asking that? Yep. Why is he asking about this time point? Yeah, so the doctor was looking at him, and you could see it in his eyes. He was looking, why is he asking that? And the person came to me for bone pain.
Right.
And they wanted to see a nutritionist because every time they had calcium and other nutrients, they had bone pain and they had osteoporosis, and no one could help them. And it was sort of like, okay, what can I do? And the GP's there. She gave me all these tests and everything I ever needed, even hair mineral analysis, Like everything you can think of this person had done, and nothing was helping. And I started asking all these different questions, and results looked weird. And I'm going, there's something weird going on here. So I sort of asked the question, you know, when you were between the ages of 10 and 12, where did you live? And the doctors looked at me. So I gave me this crazy kind of look, what's it, wacko, you know? And I'm like, yeah. And she started thinking, she said, I lived on a farm. And I said, what kind of farm was it? And she explained it. And I said, did you have any crop dusting or anything else like that? And what we ended up finding out is they were regularly using DDT and other things. And during that time, there was like heavy metal issues in the soil, like there's 50 different things going on at once, of course. So what I found out, or what I worked out, I should say, is that every time she took calcium or a mineral supplement, she was literally moving the heavy metal in her bones that was impacted between the ages of 10 to 12, that peak, that peak growth period where you're growing and everything's cementing itself into bone mineral density. And it's interesting where, he's getting really excited now, going, wow, I didn't think of this. And I'm like, yeah, it's cool. This is what we do as nutritionists. We ask all these questions and go through it. And essentially we worked out that if we went lower dose and compounding again, going lower dose with calcium and other bone nutrients and building up, we eventually started working on, I won't say heavy metal chelation, it's not the right phraseology for it, but that's what we started to do.
Yeah. Yeah.
And then she got a hair mineral analysis, a urine test. I had everything done properly for heavy metals. And it was interesting to note that her bone pain was mild because she had osteoporosis. So you're going to have, of course. But it wasn't to the extreme where she would have just any kind of calcium tablet on the market. It didn't matter. Yeah. Would cause her pain because it was shifting the heavy metals in the bone.
Yeah.
So he started getting all excited, sent me heaps of patients. And can I follow up on this? And I said, yeah, it's what's up to Jane Bloggs, she's your patient. So she, that's the relationship. You have to get her permission. So I tried to sort of, set that boundaries that I'm just going to talk about it because confidentiality. And another good resolved case, just with going back to basics, back down to foundations of diet and lifestyle and some basic nutrients. Yeah. And then again, moving away from that, I'm just a nutritionist because I was working with the GP.
Yeah.
I was working with all these different things. And that's the exciting thing.
The exciting thing of being a nutritionist is you do have access to a ton of things. There's no just a nutritionist. There's no just an anything. It is you've done this because of your passion for nutrition. And not only have you discovered buckwheat, and all these other amazing things that you discovered while you were training, but you've actually found out about a whole system of medicine compounding that's out there that you can use. And you can go deeply into it and create your own products. So, the people who run these companies all started out with their degree. That's where they started. They didn't start necessarily with a PhD. They started with their degree and they started with passion. And that's how they've built up those businesses that are product based. So you can have your own products if you want to, but you can certainly compound for every client you see if you wanted to.
And it's such a simple thing. And if we live off our philosophy that you treat the whole person, you treat holistically, you talk with the person rather than to the person. You talk with them. That's the first thing. And you have the conversation. And that's something we forget, that we're not dictating to the person like that patient you said dictated to you. It's a conversation. It's a relationship that we're building up with our patient or person, as we like to sometimes call them. They're people. And sort of, working with them for the greater good. And their greater good is improved health.
Yeah, absolutely.
Quality of life.
And quality of life. That's amazing. So I'm going to leave it there on this one. But Brad, would you come back and speak to us again? Would that be all right? Because I reckon we've got loads more to talk about on other podcasts.
Very much love to. Enjoyed today. Looking forward to it.
Brilliant. Thank you very much, Brad. And you know the deal, everyone. If you've made it all the way through to the end, we'd love a 5-star review. And thank you very much, Brad. And I'll see you on another podcast.
Thank you. Take care.
Thanks so much for joining me today. Don't forget to rate, review, and subscribe to the podcast for the weekly episodes. If you'd like even more support and learning, then the Academy is for you. Here you'll find part 2 of the herbal discussions, more clinical learning, and case studies to support your clients in practice. Bye for now.